Hello, everyone. We're Chris, Samrit, Jaf, and Lisa, and the alternative imaging modality topic we are presenting today is the nuclear medicine imaging. For the presentation today, we will be discussing what nuclear medicine is, how the image is obtained, what the professional collaboration process looks like, and how it compares to conventional dental radiography. So what is nuclear medicine? Nuclear medicine is a medical specialty that uses radiopharmaceuticals to diagnose and treat various diseases. These radiopharmaceuticals, also called radiotracers, consist of small amounts of radioactive material combined with carrier molecules. Nuclear medicine imaging is the application of nuclear medicine to produce two-dimensional or three-dimensional images of bodily structures. These can include both hard and soft tissue structures. So pause the video for a second and try to think of what type of structures you think a dentist or a dental hygienist might want to see using the nuclear medicine imaging technology. Some possible answers you may think of include temporal mandibular joint, tumors, and bone levels. I will now let Jaf take over to discuss the application and how nuclear medicine imaging is obtained.
Thank you, Lisa. So to produce an image, a solution containing the radiopharmaceuticals are introduced into the body through ingestion, or inhalation, and uses radioactive tracers to produce images of the body for diagnostic purposes, which I will discuss shortly. The most common radiotracer is F18 fluorodeoxyglucose, otherwise called FDG. FDG is similar in structure to glucose and is taken up by cells along with glucose. More metabolically active cells take up more FDG. This concentrates the radiotracer into the targeted structure where it emits radiation, which is detected by the special sensor called a gamma camera. So there are different solutions that are designed to be attracted to specific organs, bones, or tissues. Once the tracer has reached the targeted structure, the gamma camera then detects the gamma radiation emitted from the radiotracer in the body and converts it into an image. A nuclear medicine specialist then uses the image to help understand the structure and functioning of the targeted tissues. For example, physician uses this image to understand the functioning of organs and tissues. A dentist might use this to diagnose and evaluate the health of jaw bones, temporomandibular joint, or to check bones for fractures, infection, or arthritis. Next, we will talk about nuclear medicine imaging equipment. So the first one that we'll talk about is gamma camera. It detects the energy from the radiotracer in your body and converts it into an image. It does not emit any radiations itself and has radiation detector called gamma camera heads. The second one is single photon emission computed tomography, which produces a series of images that can be reconstructed into a three-dimensional image. Nuclear medicine imaging equipment also consists of PET, which is a short for positron emission tomography. It is a large machine with a round, donut-shaped hole in the middle and detects the energy from the radiotracer in the body. At last, we have the image fusion, which allows the doctor to see the information from two different exams in one image to provide a precise diagnosis. I will now pass it on to Chris, who will discuss some of the further applications of the nuclear imaging.
For medicine, nuclear medicine imaging can show metabolic hotspots throughout the body and in either hard or soft tissues. This would allow medical doctors to find any areas of abnormal cell metabolism, including tumorous growth or systemic autoimmune activity, such as rheumatoid arthritis. In dentistry, the imaging is typically contained to the structures of the head and neck. Some examples of what nuclear medicine imaging can show us are tumors and precancerous growth within the bone, RANJ, rheumatoid arthritis of the temporomandibular joint, and soft tissue tumors and precancerous growth in the oropharynx. Question for the audience. Does anybody remember what MRONJ stands for? Is it medical reformation of oral and nasal joints? No, it's medication-related osteonecrosis of the jaw. Which medication is most often associated with MRONJ? That's right, it's bisphosphonates. Many imaging centers combine nuclear medicine images with computer tomography, or CT, or MRI, magnetic resonance imaging, to produce special views. Doctors call this image fusion or co-registration. Image fusion allows the doctor to see information from two different exams in one image. This leads to more precise information and more exact diagnosis. Some imaging units can perform nuclear imaging diagnostic scans at the same time as other imaging modalities, such as SPECT CT combined with traditional CT, and PET combined with CT, or PET/CT. PET MRI is an emerging imaging technology and is only available in some locations. When these images are combined, the 3D image with highlighted areas of disease are an excellent tool for educating patients and communicating treatment needs. Periodontal destruction can be imaged in real time since metabolically active osteoblasts and osteoclasts constantly degrade and reform in the bone. In the future, periodontists may begin using nuclear medicine imaging to differentiate between active and inactive periodontal disease. However, why do you believe that this is not used more by periodontists today? Much like PCR testing, knowing if periodontal disease is active or inactive does not change the treatment. Clients still need to practice good personal self-care and attend frequent professional debridement sessions. Next, Simrit will tell you a little bit more about the role of the dental hygienist nuclear medicine imaging.
Thank you, Chris. We will now discuss the role of a dental hygienist. A dental hygienist would typically refer a patient with a lesion that needs to be imaged using nuclear medicine to an oral surgeon. In some cases, the oral surgeon may refer the patient to a specialist in nuclear medicine, such as a nuclear medicine physician or a radiologist. The specialist in nuclear medicine would then perform the necessary imaging studies and provide the results to the referring dentist or oral surgeon, who would use the information to diagnose and treat the lesion. It is important for the dental hygienist to communicate the patient's medical history, including any medications or treatments the patient is currently receiving, symptoms, and any other relevant information, to ensure that the patient receives the appropriate care and that their treatment is coordinated and effective. The advantages of nuclear medicine imaging includes provision of functional as well as anatomical information about tissues, cells, and organs, whereas other common imaging procedures only show the structures. This can be used in targeted treatments to kill or damage cancerous or harmful cells, reduce the size of tumors, or reduce pain. It is also used for early disease detection, and three-dimensional images are useful for surgical planning. On the other hand, the disadvantages are it has higher radiation doses than in common imaging like X-rays. Along with using higher radiation, some nuclear medicine procedures are longer and end up using even more radiation than others. This could cause skin reddening and hair loss. A client may also give off small amounts of radiation right after the procedure and need to take steps to protect others from exposure. Clients cannot travel into the USA while they are radioactive. I will now pass on to Lisa.
Thank you, Simrit. So lastly, how does nuclear medicine imaging differ from the conventional dental radiography? Nuclear medicine and conventional dental radiography are two different imaging modalities that are used for different purposes in dentistry. Nuclear medicine uses small amounts of radioactive material to produce images of the body. Typically, the images are three-dimensional, but can also be two-dimensional, and provides information about the metabolic activities and functions of the tissues. However, conventional dental radiography uses X-ray to produce images of the teeth, jaw, and surrounding tissues. It is typically used to provide two-dimensional images with information about anatomical structures of the teeth, jaw, such as cavities, periodontal diseases, and jawbone abnormalities. Conventional dental radiography is primarily used for structural imaging in order to detect disease progression of alveolar bone loss by radiographs. Two or more radiographic examinations must be taken, separated in time to observe disease progression. Nuclear medicine differs from conventional dental radiography because it is used for functional imaging of the jawbone and temporal mandibular joint. It determines the presence of disease based on biological activity rather than change in anatomy. The metabolic alterations can be detected in nuclear medicine, which means it has the potential to detect disease progression in one single examination. So thank you everyone for your attention. We hope that this presentation helped you learn a little bit more about nuclear medicine imaging, how it applies in dentistry, how you as a dental professional may refer a client to obtain an image using this technology, and how it compares to the conventional dental radiography we use. And if you have any question, please reach out. Thank you.